You are planning for a baby, you have started taking folic acid, you have cut down on caffeine. But here is my question. Have you booked your next salon appointment? If so, you need to check if that beauty treatment is safe for your baby. I am Dr. Soumya Dinesh, Fertility and Cell Therapy Specialist. I'm not saying that all beauty treatments cause problems. That's simply not true. But if you are trying to conceive or planning a pregnancy, some cosmetic treatments involve medications, chemicals, high heat or infection risks that deserve a little more thought. Every week, women ask me, Doctor, can I color my hair? Can I get Botox? Is laser hair removal okay? Can I continue my acne treatment? The truth is, some treatments are generally considered low risk. Some are better postponed. So today, I'm going to walk you through the salon from room to room and explain exactly what you should know before trying for a healthy pregnancy. Let us start with one of the most common questions, that is hair coloring. Can you color your hair if you are planning a pregnancy? For most women, occasional hair coloring has not been shown to reduce fertility. However, permanent hair dyes, bleaching products, and strong chemical treatments contain ingredients such as ammonia, peroxide, and other chemicals. Although the amount absorbed through the scalp is thought to be very low, many doctors recommend minimizing unnecessary chemical exposure when you are actively trying to conceive or during pregnancy. If coloring is still important to you, choose a well-ventilated salon, wear gloves if you are applying it yourself, avoid leaving chemicals longer than instructed, and discuss the timing with your healthcare provider if you have more concerns. And remember, there is a difference between coloring your hair once in every few months and working in a salon with chemical exposure every day. I have a very specific instruction for women working in salons. There is a difference between coloring your hair or getting chemical treatments once in every few months. You being working in salon, getting exposed to those chemicals on a regular basis. So you need to be very careful when you are trying to get pregnant to avoid these chemical exposures. If you still want to color your hair, a sensible choice would be foils or eyelash or a reputable semi-permanent dye, preferably after first trimester with good ventilation and minimal scalp contact. Now, let us move to keratin treatments and permanent hair straightening. Many of these treatments release formaldehyde or formaldehyde-releasing chemicals when heat is applied. Many specialists recommend avoiding these chemicals because safer alternatives exist. And also, a few months without perfectly straight hair is a much smaller compromise than unnecessary exposure to chemical vapors during pregnancy or before trying to become pregnant. Now we are entering the facial room. Let us begin with Botox. Botox contains botulinum toxin. The amount used cosmetically is very small. There isn't enough high-quality research proving its safety during pregnancy. That is why cosmetic Botox is generally postponed until after pregnancy. The same applies to dermal fillers, including hyaluronic acid fillers. Can they definitely harm your baby? We don't have evidence to say that. Can we confidently say they are completely safe? Still no. Whenever evidence is limited, we don't take unnecessary cosmetic risks. The same cautious approach also applies to newer cosmetic injectables used for skin rejuvenation or collagen stimulation. Because there is very little pregnancy safety data, these treatments are usually postponed. Now, let us talk about chemical peels. Salons commonly use glycolic acid or salicylic acid, and sometimes they use stronger peels like TCA. Superficial treatments differ from deeper peels, but elective chemical peels are commonly postponed during pregnancy because your skin becomes more sensitive and safety data for some procedures is limited. And also, pregnancy is not the best time to experiment with your skin. Many skin clinics also offer pigmentation treatments or skin lightening procedures. Radiofrequency skin tightening, hypofacials, and other energy-based cosmetic treatments also haven't been adequately studied during pregnancy. Because they are elective procedures with limited safety data, most specialists recommend postponing them until after pregnancy. Now let us come to acne treatments. This is probably the most important part of today's video. If you are using acne medicines, please listen carefully. One medicine deserves special attention, that is Isotretinoin. This oral acne medicine is strongly associated with severe birth defects if taken during pregnancy. So women who are on isotretinoin are advised to avoid pregnancy during treatment and follow strict pregnancy prevention guidance using contraception. If you are planning to conceive, never continue isotretinoin without speaking to the doctor who prescribed it. Now, let us discuss topical acne creams. Products containing tretinoin or adapalene, which are vitamin A derivatives, are generally avoided during pregnancy. If you are planning a baby, review your skincare routine with your dermatologist or obstetrician before continuing these products. Sometimes the cream which you have used safely for years may be the one that needs changing before pregnancy. Now let us focus on nails, eyelashes, teeth whitening and spray tanning. So what happens at the nail station? There would be acrylic nails, gel nails, nail glue, acetone removers. These are all products which have not been shown to reduce fertility when used occasionally. But good ventilation is important because repeated inhalation of solvent fumes is best minimized. Waxing and threading are also generally considered safe. Just remember that hormonal changes can make your skin a little more sensitive during pregnancy, so you may notice more discomfort than usual. What about eyelash extensions or lash lifts? These procedures themselves may not affect fertility. However, the glues and lifting solutions can sometimes cause allergic reactions or eye irritation. So if you have never used them before, during pregnancy or when you are planning pregnancy, it's better to avoid. Many women also ask about professional teeth whitening. There isn't good evidence showing that whitening treatments are harmful before pregnancy. However, because safety during pregnancy hasn't been well studied, many dentists recommend postponing elective whitening once you are pregnant. What about spray tans? There is no strong evidence that occasional spray tanning affects fertility. However, because the mist can be inhaled and safety data during pregnancy is limited, many experts advise avoiding spray tanning once pregnant. Self-applied tanning lotions may be a better alternative if desired. Next, let us focus on laser hair removal, tattoos, microblading, and steam rooms. Regarding laser hair removal, there isn't enough research confirming its safety during pregnancy. That is why elective laser procedures are usually postponed until after delivery. If you are planning pregnancy, it may be worth scheduling your laser sessions before conception or waiting until after childbirth. Next, tattoos and body piercings. Planning pregnancy is not the ideal time for a new tattoo because it is the risk of infection if hygiene standards aren't perfect. The same applies to body piercings. The same advice also applies to microblading or permanent makeup for eyebrows or lips. The concern is not the pigment itself. It's the small risk of infection and the fact that these are completely elective procedures which can be done later. So if you are planning a pregnancy, it may be wiser to wait. Finally, steam rooms, hot tubs and saunas. Does planning for a baby mean you stop taking care of yourself? Absolutely not. You can still enjoy self-care, haircuts, basic facials, manicures, pedicures, waxing, threading, and many everyday beauty routines. The goal is not to avoid every beauty treatment. It is to understand which ones have reassuring safety data, which ones simply haven't been studied enough, and which ones are best postponed until after pregnancy. Whenever you are considering cosmetic treatment, ask yourself 3 simple questions. First, does this treatment involve strong chemicals, medications, or high heat? Second, has this treatment has been adequately studied in women planning pregnancy? Third, can this treatment safely wait until after my pregnancy? If the answer is yes, waiting is often the simplest and safest choice. Remember, beauty treatments can usually be rescheduled, but the first few weeks of your baby's development are unique. They happen only once. So if you are planning to welcome a little one into your life, make every choice with confidence, not confusion. If this video helped you, share it with your sister, your friend, or anyone who is planning a pregnancy. It might answer a question they didn't even know they needed to ask. Thank you for watching. Take care of yourself today so you can take care of your baby tomorrow.